Hello, my name is Caitlin Chisholmore, and I'm so excited to be speaking with Ashlee Adams today on therapeutic approaches and supports for the mental health challenges of new parents. Ashlee is the Director of Clinical and Counseling Services at the Postpartum Stress Center and the Program Administrator at the Karen Kleiman Training Center. She is licensed in Pennsylvania and New York as a clinical social worker and has been passionate about working with infants and their parents for as long as she can remember. Ashlee graduated with a master's in social work from the University of Pittsburgh with a specialization in direct practice and integrated health. She has worked with new mothers and parents in community, hospital, and private practice settings in Pennsylvania and New York City. In addition to specializing in perinatal mental health, Ashlee has experience treating depression, anxiety, life transitions, and couples therapy. Welcome, Ashlee. Thank you for being here today.
Thanks so much for having me, Caitlin.
Oh, I'm so grateful for your time. And yeah, let's just jump right in. So
Sounds good.
now I've told everyone a little bit about what you do. Can you tell them about who you are and what brought you to this line of work? You said you were always interested in working with parents and infants, but why are you passionate about perinatal and maternal mental health?
Sure. I mean, it did start when I was really little with just a passion for infants and children. And then as I got older, I was working in different childcare settings, full-time as a nanny governess before I ended up on my career path. And interestingly, through that line of work, I saw directly the suffering of mothers and parents. And I started to take an interest, no matter the socioeconomic level that we were looking at, the suffering existed in the adjustment to parenthood, the lack of support, no matter what your income was, the feelings of isolation. So I began to take interest in the parents and how I could help in making more cohesive families, addressing these issues. And that's where I decided to pursue social work. I was in healthcare settings for the earlier part of my career, but I still worked in women's hospitals where I started to address mental health on more of, it was a brief level, but making sure women in hospitals knew the resources that they could have access to. And then I really felt like I wanted to dive deeper. And the field of maternal mental health, it's been blooming for years, but we haven't given enough a voice to it until more recently. And I found Karen Kleiman, I found her work, I became an active student of hers years back, and then wound up specializing in maternal mental health and now in my current role at the Postpartum Stress Center. So it's been a journey, but a wonderful journey. And I feel like through my work now, I'm really, really able to access these women and families and help them realize they're not alone.
Yeah, thank you. Thank you for all the work that you're doing across different settings. And I love the how you mentioned about the universal suffering, regardless of the socioeconomic status, and bringing like cohesion to families. I just really love what you said there. And yeah, for those who don't know who Karen Kleiman is, it's surprising that there are people that don't at this point, but can you tell us about who she is and the Postpartum Stress Center?
Of course. I mean, I would venture to say she's a pioneer in the field of maternal mental health. She recognized a need back when we were not talking about it. Women were not talking about it even much amongst each other. Postpartum depression, perinatal mood disorders, we weren't even giving them much language. So this was in the late 80s, 88, 89, when she founded the Postpartum Stress Center, Karen would literally knock on doors and just talk to women, and found that women in their 70s were coming to her saying, I suffered so much and I never talked about it. So Karen truly, through her work, through her books, through her outreach, through her trainings, she even developed the specific approach to doing this therapy, in particular, a holding approach, which we will talk about, but she truly gave life to this field. And the Postpartum Stress Center is outside of Philadelphia, Pennsylvania, in the United States. And we, since COVID, have transitioned to a completely virtual practice, but it has allowed us to outreach across the state of Pennsylvania, which has been wonderful. And Karen still has an international presence with her trainings today.
Incredible. Yeah, she's such an inspiration. Like going from door to door to having an international presence, that's very impressive. And
Right.
for good reason, because her books are very impactful and yeah, as you said, put the language to it and kind of normalized the experiences, which might have brought some shame and confusion if no one's speaking about it to you, right?
Right. And I mean, her campaign, Speak the Secret, is exactly that. What we want is for women and parents to feel safe to just say what is really happening during the perinatal period, and to give voice to intrusive thoughts, like through her book Good Moms Have Scary Thoughts. It's becoming a widely known little pocket resource, and it's just finally giving language to the authentic suffering that people are going through and what's really going on behind someone's sometimes perfect look. And we all know there's internal suffering. So it's giving voice to that.
Yeah. Yeah, can you speak to how perinatal and postpartum maternal mental health are impacted by mental health, like the mental health aspect, and what some common experiences mothers may have?
Sure. As we know, it's a world upending time, and it's a very, very vulnerable period for women and their partners and families. But maternal mental health in particular, it's such a storm postpartum of hormones, of sleep deprivation, of any mental health that you carry from your past. All of it creates a ripe environment for it to creep up. So we know an extremely common experience is the baby blues, but there's often misconceptions about it. And we'd venture to say 90 to 95% of women experience the baby blues, but that's only in the first 2 to 3 weeks postpartum, where you're seeing symptomology, but it should be fleeting. So the excessive tearfulness and mood swings and overwhelm and all of that. And then after that period, we're looking at something more clinical, whether it's under the umbrella of postpartum depression, postpartum anxiety, and other perinatal mood disorders. I would say the most common things we're looking at is sleep deprivation is universal during this time. We know little babies don't sleep much, and biologically they're not supposed to, but there's a massive impact on the parent, and sleep deprivation is a form of torture for a reason. So when you're not getting enough, it is the perfect cycle for adverse mental health. And what we see coming out of that, if you're at risk of mental health complications, is severe postpartum anxiety symptoms that can venture into kind of the OCD territory, where constantly checking on the baby, you can't sleep, you cannot sleep, you cannot turn your brain off when your baby's sleeping. We see intrusive thoughts in over 90% of new mothers. And we don't give voice to this enough. We're trying to. And Karen and we label them scary thoughts. They're just a little bit more accessible. Every human has them. We all have them. Crossing the street, this bus could hit me, but they're fleeting. They tend to not cause us a great deal of distress. But in the postpartum period, they can just storm your brain, and they can just stick and stick and stick and pile on, and they can take on certain themes: safety of the baby, wanting to escape, horrible images of things happening to your baby, but they take on clear themes. And so we're trying to give voice to this. What we look for clinically is the level of distress that the symptoms cause. So we're looking at, is this impacting the mother's ability to care for her baby, to function throughout the day? And that's how we know we want to give the thoughts less power. But if the symptoms are so severe, sometimes you just cannot unstick them. You can't will them out of your head. And that's when we sometimes look for additional treatment options in addition to therapy. So looking at medication or SSRIs. But yes, universally, intrusive thoughts, sleep deprivation, intimacy and couples issues in the postpartum period. We're seeing all of it, and just such a range of emotions, and we can't expect that it's an easy adjustment. Universally, parents around the world will say this is hard. It's hard, and it's okay to admit it. There's beauty in it, but there's also a lot of adversity that you have to overcome.
Yes. Yeah. Becoming a mother myself, I didn't expect it. I didn't expect the intrusive thoughts and like the depth of sleep deprivation and how all these things can arise, and how there's like a spectrum of the coping, I guess. And yeah. Yeah, and it's important to have these conversations to let moms know that that they do occur, and that there's somewhat of a normalcy to it, but at the same time there is help, right?
Right. And I think it's so important to normalize certain aspects, but not over normalize. Because when someone is legitimately suffering, sometimes you will see in medical settings or with those brief OB visits postpartum, there's a tendency to be like, oh, you're a new mom. It's normal. You're okay. You're fine. It's gonna be fine. It's gonna pass. But it doesn't pass for a lot of people. And if we're talking about 1 in 6 women with a clinically diagnosed mood disorder postpartum, then we need to be very careful to not dismiss and to create an openness, whether it's in a medical setting or therapy, for her to be able to reveal what's really going on.
Yeah, it can feel like gaslighting.
Oh yeah, completely.
Yeah. Yeah. Can you share some effective approaches that you have encountered, including the holding technique with Postpartum Stress Center?
Sure. So the holding technique is unique. Karen expanded upon the work of Winnicott, who created the term holding environment. Basically, that when you have the mother infant dyad, right? The mother is creating an environment of safety for her infant. She's being a good enough mother, creating safety and comfort and predictability. We kind of translate that in our therapy as the role of the therapist, as being the good enough mother to our client. We're creating a safe, open, comfortable, intuitive environment for them to be able to reveal behind the mask. So it's really a mindful, intentional intervention that provides skills and prompts to elicit this comfort from our client. And it's kind of a a symbiotic relationship between the therapist and the client, where we're almost co-regulating. The therapist is expected to hold a very, very high level of distress often from our clients. So we are regulating at the same time that we're creating a completely comfortable environment for who's sitting in front of us. So we're not missing anything. And so she feels safe to say, I'm really not okay. And this is what's really happening, when potentially out there she's presenting as everything's fine, I look good, I feel good, but we want her to tell us what's really going on so we can help.
Mm-hmm. Yeah, so it involves kind of like an embodied approach that's present, non-judgmental, so she feels safe to reveal what's behind the mask kind of thing in some ways
Exactly.
sometimes.
And it's hard because it's hard to verbalize sometimes, but it is a true technique, and truly the therapist is trained to be able to hold that kind of role of the expert, to be able to hold her distress so the work can be done.
Mm-hmm. Something that makes me think of is that you're kind of like mothering the mother, in the sense like holding the mother like you would a child, so she can help. It's almost like she has the extra space to hold the baby as well. And if you feel supported, then you have like that extra strength for yourself. It's beautiful.
Right.
Yeah. Um, so can you speak, this is going a little bit different direction, about the paternal mental health challenges? So maybe the father or the co-parent, non-maternal person.
Right. There are some nuances to paternal mental health, the partner. We're really working to give more voice, in particular to postpartum depression in fathers. It's real. There's been a misconception that only the birthing parent can experience an actual mood disorder postpartum, but we're finding it's 1 in 10 men. It's really high.
Wow, it's higher than I expected.
That's really high. And my guess is, if we're trying to access as many women as we can, but you have to think how many men are being missed. And their symptoms, some overlap, but they tend to manifest in more subtle ways. So you tend to see, for example, financial pressure. Very common as you bring a baby into the world. We know economically it's a change on the family no matter what. But sometimes there's underlying symptomology there for the father, for the co-parent, where there's this pressure, like this anxiety, this fixation on, I have to provide for my family. How am I going to provide for my family? They also experience intrusive thoughts and kind of that hypervigilance. Like, we can't take this little thing in the car. How are we going to keep them safe?
Yeah.
Are they buckled up okay? And there's the rumination of thoughts. There's tendency to withdraw. So maybe they appear uninterested in caring for the baby, in learning, in participating, but in reality, they're deeply suffering and they're distressed and they don't know how they fit in to parenting, how they fit into the equation, and are they being enough? So the symptoms can be more subtle, but they're very real, and partners deserve the voice too. And you'll often see, if a woman presents initially deeply suffering, then her partner, even if they are simultaneously suffering, will work to make sure she's okay, to pick up the rest of the stuff. And then you'll see as she gets better, he then falls because
Mm.
he's been suffering this whole time. And something has to give at a point. So we are really trying to give more voice to this. Our practice is noticing that more men are accessing care. A lot of times it takes educating their partner and then seeing, proving to them like, hey, they're suffering here too. And we recognize it.
Hmm. Those are really valuable symptoms that you laid out that I'm sure lots of people could notice in their partners, and they might sometimes we create stories around like certain things, and that there is much more focus on the baby and the mother that's like being missed. And there's a stat, I think it's like 50% of women or mothers that have a PMAD doesn't get help. So
For
if you think about how many fathers
sure.
or partners that might not because of that, or yeah, because they're like trying to hold it together kind of thing because their partner is struggling. Yeah, really important that we talk about that.
Mhm.
Um, and you work with couples in your practice as well, right?
Yes, I do. And um, you see that, I mean, 65% of couples express dissatisfaction, relationship dissatisfaction in the postpartum period. It's such a huge transition. And I think it's really hard when you're in the middle of it, sleep deprivation, the suffering, to access coping skills or to enlist maybe the communication techniques that worked before you had kids. But there's hope. It's okay to admit that it's hard. It's okay. Of course, your relationship's going to change. Of course, intimacy is going to change for a while. There's so much going on for the woman with body image and overstimulation and being touched out, and everybody's exhausted. So, intimacy, both physically and just emotional intimacy. And what we see in couples is there's this breakdown of communication, and often we have the true feelings of suffering happening within each partner. So the fear, the overwhelm, the guilt, whatever it may be. But it manifests in the couple's interaction as anger, as snippiness, as irritability, because everybody's so spent. And when you're going into the night with your infant and someone feels pressure because they have to wake up to go to work, and the one staying home is like, but this isn't easy either. I still have to parent all day. So it's really as much as possible meeting each other with kindness and like we're both we're both suffering here. Maybe it looks different, maybe certain things look similar, but reminding each other of like why'd you fall in love? What's the basis for your relationship? And it may not look the same for a while, but there are ways to maintain that connection as you're going through this transformative experience.
Hmm. Yeah, and there could be some grief in the changing of intimacy and what you might not have expected. Sometimes people think that their relationship will like relatively stay the same,
Right.
maybe. And yeah, you definitely have to have like different ways of communicating and making time. And I like the the kindness piece too, is like in those moments when you just are both at max capacity type
Right.
thing.
And Karen added to the line of good moms of scary thoughts. She added, "What about us?" for couples, because these issues come up so much, and there are common themes for couples during this period. Very unique things that appear, and again, they can be overcome. They can be worked through.
Mm, that's very hopeful.
Mhm.
That's great. Yeah, I was wondering about how partners or friends or family members, if they notice somebody that's suffering, what can they do to support them, or how can they support them?
Yeah, I mean, the point is valid that so many women, especially presenting with likely true mood disorders in this period, they can't catch up to it themselves often. They often know that they deeply know something is wrong. And some women will voice it to get the help, but some women will just keep plugging through. So the first thing is conversation of, I see this, I notice this, I care about you. Can we just talk about how you're feeling? You don't seem like yourself. You don't seem okay. So eliciting the conversation, family support as much as possible for someone who's suffering, whether they need to go stay at their mom's house for a night, or grandparents can come in and offer direct support, telling them that this is real or could be real and that it doesn't hurt to meet with somebody to talk about it. I mean, especially depending on how severe things are, but when you seek out a maternal mental health specialist, I mean, we're just here literally to provide any sort of space that is needed. So you're not admitting weakness, you're just admitting that things don't feel right now. And you're being open to, I mean, first of all, just letting it out. Letting it out in therapy can be so healing, and knowing that you're not alone, because it can feel extremely isolating and you can feel like the only one who's ever felt this way, but you are so not alone. And then a therapist can also help if things seem more severe to connect to medication providers. OBs are becoming more and more trained in maternal mental health and more willing and able to prescribe certain medications that we know are very useful for postpartum mood disorders. So SSRIs are probably the number one line, like a Zoloft or something like that. And sometimes medications in conjunction with therapy is the best treatment. So just, if partners and families become more aware that there's hope and there are options out there.
Mm-hmm. Yeah, those are great questions to start the conversation, and options for families for sure. Curious how, because you are also a mother.
Mm-hmm.
Yeah. So if you don't mind sharing how your personal experience as a parent has impacted your therapeutic role, and just what your experience has been.
Of course. I have an almost 2-year-old, and so it is very unique. I am in the trenches with everybody else. So I think my husband always says my maternity leave was probably the best internship I could have ever had for this line of work, because I entered into it way before. I always knew I wanted to be a mother, but way before I was in that life space. And I just had a passion for it. It was just there. And I remember Karen asking me in my first training, "Wow, you're not a mom yet. What brings you here? Like, what interests you so much?" But it's just been an innate passion. And then once I had my son, wow, I mean, everything was transformed, and I could see why my clients had such layered and complex feelings, and that you have that sense of the weight of the world on your shoulder, and kind of that existential sense once you bring life into this world. And I saw firsthand navigating partner, just navigating everything with your partner, logistics, sleep deprivation, and how sometimes your brain feels hijacked. And I saw it all. I saw it all. I've seen the layers now and the nuances. And as a clinician, it presents a unique challenge and also opening, because when you're in it, when you're just in this phase of life and it's raw, you have to be careful. You have to be careful not to over identify, or because it's about your client. It's about your client. And at the same time, you have a unique firsthand experience where that empathy is truly there. When I couldn't have said before, the empathy was truly there. It was more sympathy of, I feel this, I think I feel this, but now it's that raw, I feel this. So I think it's only strengthened my work.
Mm. Thank you for sharing all those details, and I love the expansion of empathy or
Mhm.
sympathy and empathy. Um, and it's like you were researching before and then you became the thing.
Yeah.
It's so fascinating because I'm sure it's like there was these two things playing. It seems like, oh, you know this is happening and it's happening, right? Like you know that it
At
would
all
happen, it could
times.
happen.
And your brain, it's like the clinician side of you is speaking to you as you're going through it, but then there's just this human you side that can often be, they can be in conflict. Even if you know the rational answer, it gets thrown out the window a lot in that time.
Yeah.
So it's not perfect and it's messy, and that's okay. I got to see firsthand that you can want this more than anything else. You can look at that baby and adore them, but things can also feel really stormy.
Hmm. Yeah, I really appreciate your just like authenticity and honesty about all of it because I'm sure a lot of moms can connect to that and be a little reassured and hopefully get some help. So I would love to share links in the description,
Good.
how they can find you. Is there anything else that you'd like to share? Any upcoming offerings or any last words for mothers and families?
I'm just honored to be here and to continue giving a platform to this entire area. Um, the Postpartum Stress Center, I mean, it offers unique opportunities, especially for clinicians in areas of training for just perinatal mood disorders and how to best serve this population. So, on an international level, there are many, many offerings for clinicians, for parents and families. All of Karen's resources, they're here for the world in many languages. So her books are widely available on Amazon, and also on our website, the Postpartum Stress Center, we have resources, we have signs to look um, for postpartum mood disorders, and resources for partners as well. So even if we can't see you at our practice, which we can in Pennsylvania, and a couple of other states like New York, but even if we can't provide the direct clinical services, our practice is there for outreach and resources.
Hmm. Thank you. I hope this really connects for professionals and mothers, and it's been really a really great conversation for me too. So thank you so much.
Thank you, Caitlin.